If your doctor has told you that your B12 levels are normal, but you're exhausted, brain foggy, anxious, or struggling with tingling hands and feet, this video is for you. Because in functional medicine, we look at B12 very differently. So, what is vitamin B12? It's a vitamin that's involved in almost every cell in your body. It's essential for energy production, brain function, memory, healthy nerves, DNA repair, the production of your red blood cells, and something called methylation, which is the process that switches genes on and off, detoxifies chemicals, and keeps your body functioning properly. So, without enough vitamin B12, your body simply can't perform at its best. But here's where it gets interesting. The NHS reference range is incredibly broad. Depending on the laboratory in your region, anything above around 150 to 200 pgml may be reported as normal. But functional medicine asks a different question. Is it enough for your cells to work optimally? And very often the answer is no. So when I look at blood tests, I ideally like to see your serum B12 comfortably above 500 pgml. And for many patients, I prefer it between 500 and 900 pgml, depending on the individual. So if somebody's sitting at around 220, they may technically be normal, but they may also still have fatigue, poor concentration, numbness, low mood, or elevated homocysteine. Why also B12 can look normal but still not be working, and this is the really important part. Serum B12 tells us how much B12 is circulating in the blood, but it doesn't tell us whether it's actually getting into the cells. You can have perfectly normal blood levels and still have a functional B12 deficiency. And that's why, when the history suggests it, I'll often look at other markers alongside it. So things like homocysteine or methylmalonic acid or active B12, folate levels, a full blood count, and sometimes even organic acid testing. The picture is always bigger than one number. So why do people become low? And this is where functional medicine really differs. Low B12 isn't always because you're not eating enough. Sometimes it's because you can't absorb it. And common causes will include low stomach acid, long-term use of PPIs like omeprazole, medications like metformin, a condition called pernicious anemia, celiac disease, Crohn's disease, gut inflammation, or small intestinal bacterial overgrowth. Um, Vegetarian and vegan diets as well, or if you've had bowel surgery in the past. So simply taking a supplement without asking why may also be missing the real problem. So a lot of people ask whether your B12 levels can be too high, and this does surprise a lot of people. A very high B12 isn't always a good thing either. Sometimes it's simply because someone is taking supplements or injections. But if someone has a very high B12 without supplementing, I want to understand why. Because it can sometimes be associated with liver dysfunction, inflammation, certain blood disorders, or an impaired transport of B12 around the body. Again, context is everything. So your take home message is don't just ask, is my B12 normal? Ask, is it optimal for my body? Because in functional medicine, we're not only trying to stop disease, we're trying to help you feel and function at your best. And sometimes that difference lies in the gap between normal and optimal.